Hey, Cynthia Allen, and I want to talk with you today about uh, back pain myths. I'm going to cover 5 of them. Sorry, trying to get my wires out of the way. I'm going to cover 5 of those myths with you that are commonly held, but really aren't true. And so these myths about back pain matter because back pain has so far been kind of one of the unsolvable problems in westernized societies. So we need to understand what really does or doesn't work, and then we can better identify our options. If you are watching on YouTube or Facebook, please just go over real quick and register with StreamYard. It's free, it's fast, it's easy, and that will allow you to make comments or ask questions or say hi, which I appreciate, and I'll be able to see your name. Otherwise, I can't see your name, so I don't really know who's out there. So I hope you'll be able to join me. Okay, let's see. Good. Well, let's get started here. So myth number one, strengthen the core and all will be better. Around back pain, myth number 1, strengthen the core and all will be better. Well, first we should just talk about where did this concept of core come from. It came up in the late 1990s based on some studies that showed there was some interesting muscle activation, deactivation with certain types of back issues. And so based on that research, really people kind of went wild with it and got really into this idea that core strengthening must be the solution to back pain. It became so popular through Pilates and then even through physical therapy that it's kind of become sort of a standard of how back pain is treated. Now, that's odd because as early as 2007, Professor E.L. Letterman actually started debunking the concept of the core stability, core stabilization. And what he really found out is, of course, there turns out that there is no real set of core muscles that you can pull away from the rest of the muscles of the torso. They really all or should be functioning on an automatic kind of pilot way for you. But in addition to that, if it doesn't really take very much core, whatever that is, doesn't really take very much activation of these 360-degree muscles for you to stand up and walk. And if you are really aware of activating more, it's likely you are doing something extra that you shouldn't be doing or even need to be doing. Now, in my own practice, I have had plenty of people who came into me that had 6-pack abs. I mean, really, really toned and had back pain. So it gets, from my perspective, it's not that what we call core musculature doesn't matter. I think it does matter, like every other muscle of the body matters, but that it's really key that we not over-focus on one area like this, and particularly not in the idea of conscious activation of muscles to solve movement problems. Movement problems are a problem of the brain. Pain is mostly a problem of the brain and how you use yourself, how you map yourself, and how you function in the world. So let's head on to myth number 2, stretching. Stretching is needed to loosen those tight muscles, and that will solve back pain. Okay, well, this gets a little bit hard because definitely people get a nice sense with stretching. They can get a really nice sense with stretching. Stretching satisfies something. Possibly it's releasing endorphins and dopamines for a really feel-good fix. But when people say they're getting a good stretch, mostly what they mean is they are running into the stretch reflex. And that means when you go to stretch, there's kind of like a muscle brain that's saying, look, this is the range that we're going to let this muscle stretch. And if you try to stretch beyond that, we will put the brakes on. And so you come up against what is already the predetermined muscle length. Again, I'm not going to say that muscle length doesn't matter, but the idea that we can change that through isolated stretching is very, very weak, very, very weak. So I think that what stretching does for most people with back pain is it does give them some temporary relief and allows them to go ahead and function maybe for another hour, 2 hour, 3 hours. But most people will do it several times a day in order to be able to maintain that. So I'm more interested in helping people learn how to use those muscles in a way that doesn't cause that feeling of chronic tightness. It doesn't cause that feeling of chronic tightness. Okay, so first we've said that, I forgot to put up my new little banner there for the second one. So first we said that strengthen the core and all will be better. And then stretching is needed to loosen tight muscles. Second one that I'd like to debunk with you. And here we go for number three. If my MRI or my X-ray shows abnormalities, anomalies, the only cure is surgery, injections, a spinal stimulator. We could just go on and on actually with things that are being created in order to try to solve back pain. Well, the research is actually extremely clear. Surgery, injections like steroid injections, epidurals, they have potentially very significant side effects, and their success rate is actually extremely low. So the higher you get into risk, we want to really stop and take a serious look at what else could be possible. The challenge with the MRI or X-ray results is once you have in your mind that you have a problem that seems like so clearly something that should be fixed, that if it is fixed will just take away the pain, it's very difficult to defocus from it. And this is why there's so much less willingness to do MRIs anymore, because they show so many different kinds of anomalies that actually should not drive treatment. Now, does it mean that it never matters that someone has spinal stenosis or bone spur? Of course, it doesn't mean that it doesn't matter. But it is just one tiny piece of information, frankly, in a sea of information about each individual. Well, how can we say that? Well, we can say that because the studies are very conclusive that the majority of the population is walking around with symptoms of a bulging disc, herniated disc, spinal stenosis as examples, and they have no pain. So when they do studies of people with these anomalies, and then they look at, do you have pain? No pain. What's your level of function like? People walk around with these problems all the time and don't have pain. So this lets us know that the issue of pain is more complicated. It's more complicated than a finding on an X-ray or an MRI. Thank you for out there, Facebook user, for appreciating the presentation. And if you go over and register on StreamYard, I'll be able to see your name. Well, what is it complicated by? Well, it's complicated by how we understand our own bodies, how the parts of ourselves exist. It's complicated by how we let pressure travel through our bodies. That means how we take a step, how the weight transfers. It's complicated by how we bend over or stand up. That these are all ways that we use ourselves. It's complicated by how we hold stress. So it could be that 10 people have spinal stenosis, and we could even say within that range of spinal stenosis, hypothesize that they have the exact same spinal stenosis, which of course is hard to have. But let's say that they did. Well, it turns out that some of them are not going to have back pain. And that's because even though that canal where the nerve is coming off the spine, even though it's gotten small, for that person, for each of these people, there is actually still enough room for that nerve to slide and glide in there. But when you start to add additional extra muscle tension or poor use of yourself, then you start to shut down the ability of the nerve to slide and glide, and you're going to get a lot of annoyance, a lot of pain. Most people who seek out programs like what I offer have got some kind of ongoing pain and some kind of ongoing struggle with either overly tight muscles, hence the feeling that you need to stretch, which turn around, and nobody likes it. I mean, you don't like the feeling of these muscles being tight all the time, and then they're holding you back. They kind of stop your movement, but they can also actually stop the functioning of the nerve. I think most commonly seen in sciatica, in very common sciatica. So it's important that when we have these results, we take them a little bit with a grain of salt. If a surgeon tells us that if we don't solve this problem with surgery immediately, we are in danger, or your physical therapist tells you that, then of course, by all means, you need to follow those directions. But when you hear physical therapists, when you hear surgeons saying, let's try this, let's try that, they're letting you know that they want to help you solve the problem, but they'd sure like to help you solve it without surgery. Now, their first line of offering is, again, often going to be steroids or epidural injections. And again, these also have their own risk. It's not as significant as surgery, but it is risky. And I know people will say, hey, I had it. It never caused a problem, so everybody should be able to have it. This is like saying I recovered from COVID and I didn't really notice it, so nobody should have to worry about it. It doesn't work like that. Risk is risk, and the numbers are very clear. So do take some time to seek out some other options. Wow, I'm moving on here to myth number 4. Bed rest is key to overcoming back pain. There's a good one. This is one that when I was growing up, this was definitely the predominant treatment for back pain, was to say to people, get bed rest. And now we know that for most situations, bed rest is a really bad idea. Sitting around, maybe even worse. Sitting around in a kind of slump position, watching the TV, maybe even worse. So it turns out that we are going to do better recovering from back pain if we have an active lifestyle. But I'd have to say it's a common sense approach. It isn't, no matter how much pain you have, push the limits of that pain. But you don't want to end up stopping your life. You don't want to end up stopping your life. Now, what are some instances in which rest might be recommended by a physician? I think you would definitely see it recommended if somebody just has a spasm that's so severe they can't get up and walk. I had one of these, and I crawled from the bathtub to the sofa, right? Many of you have experienced this. There's like no choice but to get rest in that case. And usually it's less than 24 hours. And if it's not, you can get muscle relaxants or take some anti-inflammatories from your doctor, and it will usually temporarily clear up. What do I mean by temporarily? Well, if you have a back that's spasming, it's spasming because it's letting you know you're doing something it finds unsafe. Now, it could be that it's not really unsafe. Your brain has a tendency to react extremely strongly to any threat. It's going to react very strongly to any threat. Well, why is that? Because its main job is to protect you. So it can start to spasm, sort of like when a shadow flies over you, you get a hint of something that you've had a problem with in the past, or that your brain perceives as a potential injury, and it can spasm. And then once it's spasmed once, it seems like it's easier to trigger again and again and again at earlier warning signs. So what I have found, at least for spasming, is that slowly teaching a person how to build back a good relationship with their movement and with their body will allow those episodes of spasm to occur less often, and also will allow them to get over them more quickly when they do happen. So they'll have some tools about how to allow themselves to use their breath and use very gentle movement to come out of that state. Okay, so we've got myth number 1, show the core and all will be better. We'll get that one gone. It's out the door. Stretching is needed to loosen tight muscles. Out the door. If the MRI or X-ray shows anomalies, the only cure is surgery or other invasive procedures. Out the door. Myth number 4, bed rest is key to overcoming pain. Out the door. Back pain specifically. And now we're going to look at number 5. And this is kind of a doozy. Everybody showing up has had some experience that they probably feel means that this particular approach solves back pain. So whether you say yoga, Tai Chi, Feldenkrais, Pilates, physical therapy, acupuncture have all been proven to solve back pain, well, it's just not really true. This is, as I said early on, kind of one of the unsolvable problems so far. We have no real solid evidence across any of these fields that you can get consistent results in solving back pain. That's a bummer. It's a bummer. Yeah. And so we know there's still a lot of work to be done in understanding how we can come up with a sort of true best practice based in evidence. And so you see each of these fields offering what they offer, and you will find people getting better with them. You will also find people getting better without doing anything. And then there's people who fall outside the bell curve that just don't seem to do better with these. And these are the people that I'm most interested in, is what can we do that allows the people who they've tried a lot of different approaches, and we could have also put, by the way, chiropractic and osteopathy in here. They've tried a lot of different approaches, and they just don't feel like they're getting what they need. This is the group that I'm particularly interested in with you. So, well, what can we do from here? Well, let's find out. I've got something coming up for you, so I'm hoping you're going to be interested. And it is 5 pillars back pain to turn back pain into back ease. 5 pillars to turn back pain into back ease. It's a 3-part series I'm going to be offering free, virtual, online, starting July 29th. And I'm really excited about it. Well, why am I excited about it? Well, I have worked with thousands of people over the years. I myself had issues with back pain that I found couldn't be solved with some of those items that were just listed. You probably know I'm a Feldenkrais practitioner. I didn't find that Feldenkrais solved it by itself. And so I have been working with people now for 20 years and myself. And I formed a program a few years ago called Your Better Back that I've been getting phenomenal results with. Now, I don't have any studies any better than anybody else, right? So let me just say that. I'm not saying that studies support my program. I am going to say that people who've been through it let me know, and that it works for them, has made a big difference for them. And what kind of people? Well, scoliosis, bulging disc, herniated disc, an older herniated disc. I'm really talking about things that have been going on for a while. Chronic, I'm not talking about acute, by the way. Spinal stenosis, sacral kind of pain, ongoing sacral pain, just general tightness that really feels like it limits you. spondylolisthesis, degenerative disc disease. So if these are things that you struggle with, you want to sign up for this free 3-part series, 5 pillars to turn back pain into back ease, and get started with a combination of understanding more about what actually is what I believe the keys that have worked for my clients and myself, and how you could put those into your life, and then getting early movement experiences that start to begin to remap the brain. And in my program, it turns out that yes, we do some things that would be called core strengthening. And yes, we do some things that would be called stretching. And yes, we teach you how to rest. But it's not any one of these things that ends up being what I believe helps people. It is more that they are learning about themselves and how they function. So in my last year's program, a neurologist took it, and he talks about how he didn't really know his body very well, and that he had many doors that were closed that he didn't realize were closed, and that he was able to open them up and start to use them. So it's really a fine opportunity for you to be able to grow your sense of yourself and how you can start turning that back pain into back ease by using the 5 pillars of my Your Better Back program. And I'm really glad, Hung, that you're enjoying it and that you find it a generous gift. And Taza, thank you. Thank you for finding it awesome. Good. So I've been enjoying being here with you. If you want to sign up, just grab that futurelifenow.online.com/better-back-class-2. And we'll get you started. I'll also make sure it's in the comments or the description right here on Facebook or YouTube for you too. Thanks, everybody. It was a pleasure to explore with you, and I'll be hopping online a couple of more times probably. So watch for the next opportunity. Bye-bye.